Calcium and phosphate are essential minerals necessary for bone formation, cellular processes, and energy production. Their absorption involves the digestive system, hormones, and kidneys. In the human digestive system, calcium absorption mainly occurs in the small intestine, particularly in the duodenum and jejunum, through active or passive processes. The active process of calcium absorption is regulated by calcitriol, the active form of vitamin D, which enhances calcium transport by increasing calcium-binding proteins. The passive process of calcium absorption depends on the concentration gradient, but is significantly less efficient, with only 30% of dietary calcium absorbed on average. Phosphate absorption, like calcium, primarily takes place in the small intestine through passive and active transport mechanisms facilitated by vitamin D. Phosphate absorption is generally more efficient than calcium, with approximately 70% of dietary phosphate being absorbed. Hormones like parathyroid hormone, PTH, and calcitriol increase blood calcium levels by enhancing intestinal absorption, renal reabsorption, and mobilizing calcium from bones. Calcitonin helps lower blood calcium levels by inhibiting bone resorption and decreasing kidney reabsorption. Once absorbed, calcium and phosphate levels are balanced by the kidneys, which filter blood and reabsorb or excrete these minerals as necessary. Imbalances in calcium and phosphate can lead to conditions like hypocalcemia, hypercalcemia, or phosphate disorders, affecting bone health and bodily functions. Understanding calcium and phosphate absorption mechanisms aids in crafting dietary recommendations and medical interventions to ensure optimal health. This knowledge underscores the importance of adequate vitamin D intake and balanced nutrition for promoting proper mineral absorption and overall health.